I'm Dr. David Levine, and today is May 18th, 2024. I'm in Boston, Massachusetts at the annual meeting of the American Association of Plastic Surgeons. In a nutshell, I have the honor of interviewing icons of plastic surgery who are teachers, authors, and innovative surgeons who have been instrumental in making plastic surgery what it is today. Over the past 10 years, I've interviewed over 40 surgeons, and today I have the distinct and honorable privilege of interviewing Dr. Bahman Guyuron. Dr. Guyuron, thank you for coming.
It's my pleasure.
We start out pretty simple with these interviews, just some basic questions. If you would state your full name and date of birth, if you're so inclined.
Yeah, I'm Bahman Guyuron, and I was born in March 24, 1946.
And would you give us the name of your parents?
Muhammad and Aliyah.
Okay. And you were born in, we talked about this.
Yeah, I was born in Tabriz, Iran, which is a small city. It used to be small at the time in northwestern part of Iran.
Okay. How many children, grandchildren, or if you have any great-grandchildren?
Yeah, Laura and I have 3 sons and 7 grandchildren. And we are so lucky, all 3 of them live in Cleveland, actually.
Now, any of them in the field of medicine?
No, David, unfortunately, I think I managed to turn them off against medicine because the younger generation, unfortunately, they don't want to work as hard, and they saw how hard I was working at, and they didn't want to follow that path. But fortunately, again, in different ways, I'm involved in all 3 of them. We work together in a variety of projects.
Right. Now, they live within traveling distance for you?
20 minutes, yeah.
Oh, fantastic.
They all are in Cleveland, yeah. Longest one is 20
wonderful,
minutes. Yeah.
Wonderful. Now, how did you meet your wife?
I met Laura when I was a plastic surgery, a general surgery resident in Boston. And she was a nursing student. That's how we met. That's it started there. But actually, she's from Cleveland, Ohio, where we ended up being, and she was being trained in Boston.
Okay, so well, we'll get to it. Is that how you ended up there? But we'll find out in a second. Okay, what inspired you to go into plastic surgery?
David, throughout the general surgery residency, anytime I closed a laceration, repaired an incision, I can tell you how often somebody told me, you should be a plastic surgeon. And plastic surgery was the last thing on my list while I was a general surgery resident, until I got to the last year of general surgery. I considered doing fellowship in cardiac surgery. I considered doing fellowship in cardiovascular surgery. Then I thought, you know what, with all the things that I'm doing, I'm enjoying actually the finesse and being able to involve in all over the body more so than anything else. And that's how I decided to pursue plastic surgery.
It's interesting because I think about why I went into plastic surgery. I have a special bond with plastic surgeons. When I went to the University of Virginia, Milton Edgerton had started the first department of plastic surgery. Prior to that, I went to medical school, so I was 68, 69. He came there, and we had to get a mentor. He was unpacking boxes, and I knocked on the door, and I'd already read about him, and everybody when I went to UVA, and they said, what do you think you want to do? I said, plastic surgeon. Most of them laughed. By the time I was finished, Mark Constantian went into plastic. Now, I think he already had inclination, and 2 other members of my class. Well, 4 out of 80 was a lot for plastic surgery because they saw what plastic surgery was, which is, as Milton Edgerton had described, it's the rainbow of surgery. We do everything. which to me makes it so fun. Anyway, this interview is about you, but
Yeah, actually, Mark Constantian was 2 years ahead of me in a general surgery plastic program, and I knew that he actually decided to go to plastic surgery. The reason that actually what delayed my decision is that I had no rotation throughout that 5 years of general surgery and plastic surgery. I just had some exposure indirectly, and that is, otherwise I probably would have made my decision way before the last year.
well, I think at least, I hate to say this, our generation, plastic surgeons were kind of you knew what you wanted to do when you learned about it. Today it's a little different, I think, but we'll see 20 years from now. But to me, it was a combination of all the arts of surgery. And that to me is what made it so enjoyable and fun. It wasn't just cleft lips, it wasn't just trauma, it was everything from A to Z that made it so fun. It was the challenge. You have any mentors you'd like to mention at this point that who've helped you?
Obviously, we all have individuals that we respect, and they were instrumental in our course. It started with Paul Tessier from the craniofacial field, and then Ian Monroe. I did a fellowship with him. Jack Sheen really opened my eyes to be able to see the nose the way we should see the nose. Jack Gunter helped me to be able to deliver the results the way I wanted to deliver. And I have learned from a lot of people throughout the course of training, but those are the individuals that have had the biggest role in the designing my practice, my interest.
Well, fortunately, and I never got to meet Dr. Sheen. We shared a story about him. Jack Gunter was in Dallas, so I got to know him on a personal basis. Great surgeon. And I got to meet the icons, which is kind of the purpose of what we do here, is to preserve for history what people that have had this connection, because as you know, in our profession, we're not that far removed from the beginning of plastic surgery. I think that 1946 was, when the society formed officially. But in any event, yeah, those are great icons and leaders of our profession. And I agree with you that Sheen's concept of the nose, I don't know why we didn't see this before. It was pretty straightforward, but he did such a beautiful job in what he did that I remember the first meeting where he presented this and the audience was dead silent, quiet. It was like, holy cow, look what we can do. So that's kind of neat to have been in a meeting at that point when he presented his stuff. Look, you've seen a lot of paradigm shifts in plastic surgery during your illustrious career. Tell me a little bit about them and how they affected you, if you can.
Well, the first, obviously, over the 44 years that I've been practicing, I've seen changes that have been really important in plastic surgery. The first one was development of craniofacial surgery. Then soon after that, we got focused on musculoskeletal flaps, skin muscle flaps. Then came across microvascular surgery, and I got focused on the nose again, scientific ways of planning the rhinoplasty. Then we got involved in non-invasive facial rejuvenation, fat injection, the stem cell effects. That has been an enormous change in plastic surgery. And obviously my passion, the development of surgical treatment for migraine headaches, which is one of the focus that
Talk about that a little bit, because I couldn't find any, I didn't go to the literature, but this is a surgical treatment for migraine headaches, or non-invasive. What is it specifically? Because that's now a subspecialty in your field, from what I could tell.
It is, David, and it started actually. One of the things that I emphasize to the students by listening to the patients and not dismissing what I was hearing. One patient who had forehead lift came for a follow-up 6 months later. A surgeon's wife. Not only I'm very happy about the way I look, I haven't had migraine headaches since you operated on me. I thought that was a coincidence, but I didn't ignore it. 2 weeks later, another patient told me the same thing. So that was the beginning. But I've been fortunate enough to have research team around me all the time. So we went back and looked at, I had done 320 endoscopic forehead lifts along the previous 10 years, and 41 of them had migraine headache, 39 of them had already complete elimination or significant improvement. That was the beginning. Now, since then, I have done, that was a retrospective study. We have done prospective pilot study, prospective randomized study, prospective hand surgery, long-term follow-up, and multiple centers have confirmed my findings. And obviously over the last 24 years, and I've published 44 articles about the migraine surgery treatment, and we were getting like 90% response rate, 90% success. And the basics are about elimination of the trigger sites.
Okay.
When I introduced the concept, which was not a really totally new concept at the time, somebody else, a neurologist, has talked about also that migraine headaches are starting from periphery, is a cascade of events that begins from the periphery and continues to the brain. That's when we get nausea, vomiting, and all the other symptoms. The neurologists absolutely were adamantly against it. They said that this is actually turning our accepted theories upside down. Today, and a huge number of neurologists are just not only accepting it, actually, a guy named Rami Bernstein from Harvard is doing research, has shown that what I was supporting at the time is the reason for migraine headaches. And by stopping those irritation of the peripheral branches of the trigeminal nerve or occipital nerves, we can actually stop the migraine headache.
Wow. It's just a serendipitous event.
It was a serendipitous event
that you recognize it.
But you really have to go after, because that was only the forehead. Since then, we have found actually 7 different trigger sites, and I have developed a surgical treatment for each one of them. And that's what gives us the highest level of success. I have developed a map, an algorithm as to how we can actually identify the trigger sites and go after the trigger sites.
Interesting. We don't have time here to talk about. I'm going to ask you when we're finished about other theories, because that's interesting what you presented and what you're doing, and obviously your success rate is pretty outstanding. That's 3-4 standard deviations outside the norm. It's not.
And that actually was a problem with the neurologist. I debated a neurologist from Germany, in Boston actually, many years ago. He said that we can't accept this number, 90% or so response rate, because in neurology, if we have 5% positive results, we are delighted. How can you have 90% response rate? That was actually a source of their most powerful argument. I said, in surgery, if we don't have 90% success rate, we consider a failure. So which is true about everything that we do.
Yeah, our gold standard is a little different.
Right.
Okay, let me ask you this. What do you feel is the greatest mistake we've made as a specialty?
I think along the way, David, we have lost some fields that we should not have lost. For example, head and neck surgery. It really is a rarity now in plastic surgery. It is almost taken over by ENT in terms of ablation, in terms of reconstruction. Hand surgery, we are hanging there. We don't have the control. Or possession. We really did not embrace some of these fields the way we should have. Or even non-invasive plastics. You know how the dermatologists are running away with it. Part of our problem is that particularly dermatologists, the numbers are not the same. There are so many dermatologists versus plastic surgeons. We need to train more plastic surgeons. So those are the things that I think we could have, we should not have lost.
Okay, well, I agree with you. I think we've lost some focus in that, but that's a conversation for another day. That could take 5 hours. Bahman, I'd like to ask you what your greatest joy in plastic surgery has been, or just your greatest joy.
David, my greatest joy in plastic surgery is obviously doing rhinoplasty and migraine surgery. My life greatest joy is my family. My wife, who has been tolerating me for 46 years and understands why I'm not there in the evening so early, why I am working so hard on the weekends. And also my 3 sons who are in town with us in Cleveland, and 7 grandchildren. I'm sure you have grandchildren. There is no joy that matches it, being with your grandchildren.
We won't get any argument there. Okay, now you haven't retired yet, but I have a question about that, but I would ask you this. What words of wisdom would you give to present and future generations of plastic surgeons?
Just having learned from my own experience, David, I can tell you that number one is to listen to the patients. Patients, in my view, are number one mentors throughout the years. We learn the basics of plastic surgery, but we learn more from the patients. And think about the number of times that you and I have done the surgery for the first time on a given patient. That is, if we watch our results, good or bad, they are teaching us. We really have to appreciate that. Second is having ambition and going after your dreams. Dream big and go after it. Show tenacity again, show persuasion, show willingness to work hard to get where you want. That's what has brought me to where I am. I couldn't be happier.
Well, I think those are great words of wisdom. And one of the questions was any words of wisdom as far as retirement, but you're still working, which I think is great. That you have that ability to continue to work at this point and still be a contributor to our profession. So I can't ask you words of wisdom for retirement because you're still working, but I think that's
I'm
great.
working, but I think I would not retire unless I'm confident that I'm going to be happy with the retirement, or I have an unfortunate situation and I'm forced to retire because my hands are shaking or my mind is not working. My nurses remind me where I'm supposed to be. Steps of rhinoplasty. Rhinoplasty has 60 different steps. And at the moment, they don't remind me. I do it, so I can do it.
Yeah, well, that's your own self-test, isn't it?
Yeah. It is. I think that's when I get to a point that somebody may remind me that, okay, don't you think that, Dr. Guyuron, how about this, doing this? That is when I'm going to retire. If I can't deal with that, it's not the way. We're going to be hurting patients. When I feel that I'm not serving the patient, at the moment I have just so much experience to offer to the residents, to the patients, that I think it will be in a way disservice to abandon them at this point. But I will not hurt the patient.
Well, I'm guessing you're your own worst critic, so you'll be the first person to understand or admit that transition has occurred. But you've put in 40, how many years now at this point?
44 years.
Almost a half a century. Yeah. That's a long time.
It's a long time.
And seen a lot of changes. I'm going to ask you, because I'm interested, I wanted to hear what you have to say about your predictions for plastic surgery over the next quarter century. And please mention what your opinion is of artificial intelligence, which is now just on the horizon.
No, absolutely, I would have told you anyway. So there's no question that AI is going to be an integral part of plastic surgery, and if we put it in the right use, it is going to actually help us to serve the patients better, see the flaws better, plan the surgery better, and achieve better results with fewer complications. But I also can tell you that, in my view, especially in the field of aesthetic surgery, the direction is going to be more non-invasive. And in my view, a quarter of a century from now, most likely facelifts, eyelid surgery, at least facelift, neck tightening is going to be obsolete. For those who are going to follow the treatments in an early age, by the time they get to 70, 80s, they may not need a facelift. And skincare products, that's another thing that we let it go. We need to be focused on a skincare product. No patient of mine would have a facelift without advice about what we need to do actually we have reversed the aging, we're going to keep it there. And we can do that. I'm convinced, as convinced as I can be.
Well, from what I've read about you and what we're talking about here, it's obvious that you, as an icon, have embraced what the future has brought us and combined that with what the past has allowed us. And I have to tell you, it's been a distinct honor to interview you today, Bahman. You
My pleasure.
are an interesting person.
Thank you.
And thank you. Okay.
Yeah.
Thank you. Thank you so much. And I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. I'll repeat that. meeting.aaps1921.org. And thank you.